Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athlete trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this week's episode, we have a story episode with stories that are humorous.
And so it begins.
Well, I was going to say partly humorous because the humerus is part of the shoulder. But then I was like, well, no, maybe they're all humorous. I don't know.
You know, it's been a while since I wrote this, since we were recording. So I don't actually remember if we have any humorous stories, but we do have a bunch of more scapular fracture stories.
That's why. Is this like common for people?
This is what I'm talking about. So this is a follow-up story episode to what we did a couple weeks ago, the BOC IRL episode, where we take real life stories and kind of pair them with BOC topics and kind of bridge that gap. Mm-hmm. So what you're studying, you can actually see like in real life or how it presents in real life. But we got so many stories that I just couldn't let them. There are some stories that like are good, and I just like, you know, you have to make a creative decision and
judgment call.
Right. It's like same as athletic training. And there are some stories that I'm like, man, maybe I should put this in like a miscellaneous episode, like just keep it. But there were just so many good shoulder injury stories that I was like, I just don't think we can lay this one to rest just yet.
Yeah.
So this is basically the follow-up of all of those. We got so many good stories that I just wanted to put them together, and we got so many scapular fractures. You want to just start with that?
Sure.
Scapular fracture stories? Okay, so the first one's anonymous. They said it was a football athlete, a wide receiver, dove for a ball and landed with his arm abducted.
Okay.
Initial evaluation presented as a soft tissue injury. Re-eval next day, he wouldn't even move his arm actively or passively. So, of course, we sent for x-rays and fractured his acromion.
That's interesting.
The athlete got 3 opinions, and one doctor actually disagreed, said it was an AC joint sprain. But then our team doc ordered a CT, which confirmed the fracture.
Nice.
So then he ended up being in a sling for 3 to 4 weeks and non-contact for 6 weeks.
Bummer. That's crazy.
You know what? It's really annoying. Actually, like, I know it's like not their fault, but like it's so annoying when like you send it to multiple people and they all answers. There's like, it's like which one's right,
I know, that's a bummer. I mean, I get it, right? Like you're just going off of what you see,
right? No one's being malicious.
Yeah, that's weird. Yeah, I know, I hate that.
But I feel like the scapular fractures ones, the more that we got, the more it seems like it presents like a soft tissue injury.
I know. Now I'm going to be like super cautious.
Right. You want to read the one from Alicia K?
Yes. Alicia K says, it was weird for us. We had a football quarterback get hit and he had pain all over. Sent for x-rays with our team doc and nothing. Sent for CT and incidentally found a fracture on the inferior tip of the scapula. Really weird. That is weird.
Also, I think, so in the last one, I think we shared May's story about like that broken dish plate kind of feel like a scapula. I think when I was going through school, that's kind of what I pictured, like this scapular fracture, but I didn't even think, I mean, I guess you could just get a little like acromial fracture or like the inferior tip of the scapula. Like it doesn't have to be this whole giant
Also, that's
fracture.
a bummer. Like I feel like pads should have protected that better.
Yeah.
That's weird. I mean, inferior tip, I get maybe.
Quarterback pads are... Oh, no, but they do have rib protection.
Yeah, they do have... Well, maybe he didn't wear the flak jacket.
I don't know. Also, who knows if they're fit right?
Yeah, true. Well, it's probably not... It's not cool.
Yeah, no, it's not cool to wear pads that fit you.
Yeah. It's all about the drip. Like the knee pads... Those are suggestions.
Oh, those are gone. Actually, you know what's new, I think, recently is people stopped wearing their girdles.
Really?
Yeah. So they just wear the little tiny thigh pad and the little... Oh, they don't even wear the knee pads. I was going to say,
are guys even wearing the thigh pad anymore?
Some of them don't wear anything. No girdle, no thigh pad. Do you know how many quad contusions... This is not a quad episode, but do you know how many quad contusions I got this year?
And you know what? My favorite will always be the confused looks that they have. Like,
Well,
I just don't know why.
Yeah.
Oh, well, I can tell you why. You just don't like the answer.
Right. No, you get either the ones who like know exactly why and they're like, damn it, I should have worn a thigh pad. Or I should have worn my girdle.
Miss Sandra was right.
No, not even me. And just like, they're like, damn, like I should have worn it.
Yeah.
I had a guy who got a hip pointer and that's like the first thing he said.
Should have worn my girdle.
Yeah. Okay, we got one more scap fracture one. Have you ever had a scap fracture?
No.
I thought I had one, but only it was an AC joint sprain. I thought it was an AC joint sprain, but he was like literally in so much pain. I was like, maybe you just had a little fracture in there.
Yeah.
It was not.
Yeah, no. Never had a scapular fracture, knock on wood.
This is from Kevin Joyce.
A cool one from Kevin.
Yes, cool from Kevin.
So Kevin says, won a bottle of Johnny Walker Blue from an ortho because I correctly diagnosed this. Men's lacrosse athlete was slashed across the back. He had pain while externally rotating and trying to maintain good posture. Tender to palpate spine of the scapula. I thought scapular spine fracture. Sent them to our ortho. He said the only time you see those is in a motor vehicle accident.
You know how many times docs have said this?
Yes, I've
feel like
heard
it's
that
very
before.
common.
Yes. I was talking crap to the doc beforehand as we were standing by the light box. Yes, I'm so old we actually had x-rays on film.
That's so funny.
I know, I haven't seen those in a long time. So that's where we made the bet. I bet him a bottle of Johnny Walker Blue. I was right and he was wrong. He put the film on the box and it showed up right away. I just smiled at him. He stormed off, and 2 days later, when he came to cover the game, slammed a brown paper bag on my desk and walked out. Never said a word about it again. What a victory.
Right?
Yeah, I feel like that's
in multiple ways.
Yes. I feel like that's such a response.
Johnny Walker Blue, that's a good call,
yeah,
too.
that is a good call. That's only in motor vehicle accidents. Well,
I know.
As we were learning, sports are basically
a
motor vehicle
accident. Okay, you want to hear the one that was basically a motor vehicle accident?
Yes.
So Rachel S. said, had a high school boys lacrosse athlete got checked in the collarbone. Kept playing.
Okay.
Shot, missed, and then got shoved over, and he landed on the same shoulder before he finally came out to have me check on him.
That's so unlucky.
He said it felt like a stinger, but didn't hurt too bad. Coach made him get checked out by me. I started palpating. Suddenly, I can't feel the middle third of his bone. As adrenaline calms down, he realizes he can't breathe. When he breathes, he gets dizzy.
Oh, no.
Pulse ox and radial pulse were decreasing quickly.
Oh, no.
I called an ambulance, transported, and he was in emergency surgery shortly later.
Oh, no.
Official injury was a grade 3 AC separation, clavicle completely broken through the bone in 2 places, with the middle portion puncturing the pleural cavity, and anterior SC joint dislocation.
That's crazy.
Toughest kid who thought all that was just a stinger at first.
That's crazy.
And fun fact, this was my first ever lacrosse game and a first year baby AT. I had been certified less than a year, so that was fun.
Nice.
I feel like honestly some of your worst injuries are in your first year.
That's where you're that first few years of your certification is when you start seeing the crazy shit.
I really think so.
Yeah. Like, here you go.
Like, I feel like my first few years I got a lot of crazy things, and then for the next couple years, like, I didn't see. And then for like 4 years, I think, what was the period of time that I didn't call 911? 4 years.
Yeah, probably 4.
4 years.
Dude, that's crazy.
I know.
Also, that teaches the kiddos that there can be more than one injury.
I know.
At one time.
Yes. Yeah.
They could have multiple things.
Okay, I like this next one because you fall on your side, you get a clavicle fracture, right?
Yeah, duh.
And you think to palpate the side on...
that they fell on.
Yeah. Okay, read this one.
So this one's by Austin M. This past Friday night football, linebacker was part of a tackle late in the game, landed on the opposite shoulder and piled on by the others on the injured shoulder. Felt pop immediate pain. Came off the field and saw me. Thought AC at first. Game was over for defense, so removed from play. Full eval after the game. Point tender, middle 1/3 clavicle, and some swelling. Shoulder squeeze produced pain at site as well. X-ray positive, non-displaced. First time I've ever seen one not fractured the side patient lands on. Yeah,
so
that's
he
unlucky.
like landed, and then people landed on top of him. So I assume that's what broke his clavicle.
Yeah,
Isn't that crazy?
I would assume that the people piling on him. I'm trying to think. I think I kind of had that. I had a basketball athlete dive for a ball, and someone dove on top of him and fractured ribs. 3 and 4.
That's pretty high.
And
up.
I think it was on the one where he got landed on, not the one that landed on the court.
Oh.
And I don't think I think it was the one that someone landed on. That was actually last year.
Oh.
Yeah.
Wow.
Good soup.
Okay, so Sofia W says, I was working PRN for a 9-man state football. I've never heard of 9-man.
I know, that's interesting.
A young man came off holding his shoulder, but repeatedly brushed me off and said he was fine. I had a student just ask me, like, what do you do if they just don't let you eval them? It's a tough one.
Yeah. I mean,
depends on what it is.
Yeah, like if it's like, I feel like in my head, because like I don't think I've ever had guys like that resistant. Like usually if something's really bothering them.
I've had an ACL who didn't want me to look at his knee. Basketball.
That's wild.
Mm-hmm.
I feel like at that point I'd just be like, unless it's like super dangerous, I'd be all right. And then I would just, if anything, I'd almost go to the officials and be like, yeah, that guy can't sub back in.
I think it depends. If you're PRN.
Yeah, PRN, yeah.
Like,
that's
officials.
hard. That's
officials,
hard.
yeah.
PRN's hard.
Yeah, it's so hard in so many ways.
Yeah.
But for my coaches, I just tell them, okay, this guy's not going to let me look at him. And then they yell at him.
Yeah. What? Yeah.
Go see Sandra. Finally, at halftime, he was down on a knee crying. And I said, you don't have a choice anymore. That's a good one. Yeah,
you're done. You've chosen wrong.
Went in to palpate and felt a sharp, bony projection still in the skin. Took him over to our doc and got him a sling and sent for x-rays. He had played since the first kickoff with a fractured clavicle because I wanted my ring. I will never forget the kid, though. Has to be one of the toughest individuals I've ever worked with. We are just lucky it didn't lead to a horrible secondary injury.
Not wrong. That could have been a lot worse.
Or like open.
Yeah, could have been a lot worse.
Open, infection.
But for the ring, Ted, it's for the ring.
You know what?
In 9-man state football, we're going for the ring.
Yeah, it just doesn't make sense. I mean, I guess in the moment it might make sense to them. Like they think they're better than the next guy who's uninjured.
Yeah. Yes. Also, too, like, young gentleman here, you know, he probably for sure thought, like, I'm a gamer.
Yeah.
I can make it through.
For sure. That's where my favorite line comes out. You got to find the line between tough and stupid.
Yeah. Also, too, you can remind them if you play stupid games, you get stupid prizes. I had an athlete tell me that one time. And I was like, yeah, you're kind of right, dude. He got hurt, and that's what he said. He was like, yeah, I was doing something stupid. And I was
at
like,
least he realized it.
And he was like, well, if you play stupid games, you get stupid prizes. I'm like, there you go.
See, most of the time they don't fight me on it. They're like, As soon as they realize, like, come on, dude.
Yeah.
You don't need to be tough for this one.
Yeah. Yeah, I think
because there is plenty of times you should be tough.
Like,
there are times that I tell them, like, dude,
yeah, you got to be tough on this one.
Yeah.
No, like I get, like in this case too. Like I don't know the context. Like if this truly championship or something
right.
going towards a championship, because like that's what I usually say. Like the guys that are like wanting to like how my guys say thug it out, like in their off season, I'm like, dog, why?
Yeah.
Right? Like I get it. Like when it's like we're in like conference play and like we only have a month left of season, 2 months of season. Like, okay, I get it. But like, dog, it's July.
Honestly, that's what I tell them too. Like if I have to take him out of a game for something that I'm like iffy on, I'm like, if this were the state championship game, it'd be a different story.
Yeah. but we're in July.
Yeah. But it's not the state championship game. Let's try to get there.
You gotta be smarter about it.
Yeah. You want to read the next one by Sienna S?
Yes, Sienna says, I've had one obvious fracture where the shoulder dropped and the bone was popping out, and it was immediate sling and refer to the ER. I've also had one where it looked quote unquote swollen, but nothing was obviously displaced until I palpated. I palpated both clavicles at the same time, and the fractured one was squishy. There's no other way to say it. It was so weird. Sling and refer to the ER.
Dude, I've never had one like that. Like, I guess...
You haven't had the squishy clavicle?
Until people started submitting story. Like, I've had a lot of clavicle fractures, but I don't think I have ever had one where it was inferiorly displaced, I guess.
Okay,
where you don't feel the bone.
Yeah.
I always feel all the ones that I've had, I've always felt either the sharp pointy tip or I've felt the crepitus. Or like
that's good that everything's like fairly non-displaced.
Right.
That's good.
But that's like such a good explanation.
Yeah.
Like, I feel like now if I get one, I'm going to be like, oh, this is what they were talking about.
Yeah. My favorite will always be the radius fracture that I got, that she was like in no pain, and I palpated where the fracture site was and her thumb would move.
Oh, yeah, that's crazy.
That was so fun. And I was like, does that hurt? She's like, not really. I'm like, oh, okay.
Oh, cool.
Well, you're getting an x-ray anyway.
Right. So Sam R has 2 clavicle fracture stories. Says, first was a rugby player who landed on his shoulder after tackling, walked into the ATR reporting shoulder pain and inability to move his arm. It was a clavicle fracture with inferior displacement. It was my first one, so I was slightly taken aback because it just disappeared. It was empty where his clavicle should have been. See, this is what I'm talking about. Like, I've never felt that.
Weird.
We did a sling and swathe in most comfortable position and sent for imaging. The second one, football player walked off the field saying something was wrong with his shoulder after making a tackle on kickoff. Superiorly displaced clavicle fracture, put it on a sling, ice, imaging with the team doc the next day. Both end up having surgery. The rugby player should be returning for the spring. The football player is hoping to be back for playing for the end of his senior season.
Nice.
I had a football player who fractured his clavicle in thirds, and
what?
The middle piece was like coming up and like tenting the skin.
Oh, okay.
And he ended up going for surgery. I don't remember how many weeks it was. I want to say it was like, was that October? No, it couldn't have been October. It must have been September. Maybe like 6 weeks.
Nice.
And he came back. He was a tight end. I was like,
a trooper.
That's like, I thought you were done for the season.
Good.
I thought you were done.
Good.
That's
soup.
crazy.
Yeah, that is crazy.
Yeah.
That's wild.
Especially like tight end.
Yeah. It's a very demanding position. You gotta block and catch.
Right. Do you have any clavicle fracture stories?
Honestly, no. I'm trying to think. I don't think I've really had. I mean, also too much. Now I guess most of my sports could have the potential for that. But no, I haven't.
I feel like
my most fascinating one was the rib fracture, ribs 3 and 4. I thought it was a first rib fracture.
Oh yeah.
Because he had it was weird. He had like pain, like going up into like his neck, like basically like levator scapula, upper trap stuff. Mm-hmm. So it was like, and he had like pain with certain manual muscle tests. I can't remember right now, but yeah, I was like, man, you might have fractured your first rib.
That's crazy.
Yeah, but no, it's 3 and 4.
I feel like they're like pretty close.
Yeah, they're pretty close.
Especially like levator scap and you said scalenes.
Yeah, or upper trap.
Upper trap.
Yeah, and maybe scalenes too. He might have had some kind of going in there too.
There was a clavicle story I was just about to share. Okay, so I actually should have re-listened to our BOCRL episode because I don't know which shoulder stories I already shared. But we did have this. It wasn't a clavicle fracture that I responded to. But one of my guys, I think he was coming in for a shoulder injury. Mm-hmm. And then I was like looking at his skin. So he took off his shirt, and then so I saw his clavicle, and there was like this giant, like keloided scar, like
Oh, interesting.
maybe like 5 or 6 inch scar.
Uh-huh.
And I was like, what is this? Like, what happened?
What happened?
And he said that he fell off of a ladder, which
Okay.
is actually, I think, one of the most common ways to fracture a clavicle.
Oh my gosh.
But
I'm scared of ladders.
yeah. But it wasn't from him falling off the ladder. It was actually from the ladder falling on top of him.
Oh, that's so sad.
Right.
Dang it.
So like he fell off of it, but then the ladder came and like sliced
I was
his
going to
like,
say added insult to
Right,
the injury there.
right. Ouch.
Or maybe added injury to the insult.
Yes. Okay, we got another clavicle. You know what? Actually, I remember there being a lot of scapular because I was like surprised
Huh?
that we got, like, I thought we were going to get 0.
Yeah.
Like, I've never, not in person, have I ever talked to another athletic trainer that has had a scapular fracture.
Yeah, for sure.
So I think when I posted, I wasn't expecting like people to come out of the woodworks with all their scapular stories. But actually, we got 1 million clavicle stories. And I was thinking we were going to get 1.5 million shoulder dislocation stories.
Oh, yeah. But I feel
Because I feel like everyone has kind of
Yeah.
had a shoulder dislocation. No. I think maybe 1 or 2.
interesting. Huh. That's crazy.
Yeah. So here's another clavicle.
So this one's by Maddy S.
But also they're like so unique.
Yeah,
Like it's
they
not
are.
like all the same.
Yeah.
Sometimes like I have to pick between like, oh, this one's really good, but like it's very similar to one I
Yeah.
already got. Like I feel like these are all very like individual.
Yeah. Maddie says, it was one of my first tournaments working as a certified AT. Well, of course. You get a lot of emergency experience at those big tournaments, LOL.
Yeah.
But it was 10 minutes into a 12-hour day. And luckily, it was at a field right by my tent. So I actually saw the kid go down after getting shoulder checked / bodied by an opponent. When I got there, it was pretty obvious his clavicle was fractured. I calmly told him what I thought, radioed in a staff member to come help call an ambulance, and me and the kid and his parents just calmly hung out and waited for about 10 minutes. I asked him if I could take a picture of the fracture, and he said yes. And since it was his collarbone and I knew help was coming, I had him stay put because I knew getting up was going to be very painful.
Yeah.
Once the ambulance got there, they sprayed pain meds up his nose and loaded him up and left. Then I proceeded to work soccer for another 10 hours.
Dude, I don't think I've ever had anyone spray pain meds up a nose.
Wait. I want to know why the ambulance is having kids snort pain meds now. Like, I've never heard of this before.
Me either.
That's crazy. One, I want to know what the pain meds were. I want to know how they did this.
Yes.
This is crazy.
And like, did they work?
Yeah, I want to know. Did they actually work? Yeah, why are we having the kids snort pain meds?
I have no. Also, I feel like
Weird.
like, is it one of those, usually nose sprays you have to like in at the same time?
Yeah.
So like, are they?
All right, buddy, take a deep breath. Boom.
Yeah, but do they have to do it to someone calm, or like can they do it to someone who's like hyperventilating?
Yeah.
I don't know. Or like you can't really lay down either, right? Because usually you have to like lean forward, so you don't swallow.
Oh yeah,
the pain
good point.
meds.
Yeah, good point. So many
I mean,
questions.
it makes sense because it would get in your system fast.
Yeah, so many questions.
But I don't know. It like that was really fascinating to me.
So many questions.
Also,
I bet they
feel
just wanted to try it. They had it and they're like, hey, let's see if this actually works with this kid. I guarantee that's what it was. There's no protocol in that.
No, they're like, I'd much rather do this than an injection.
Yeah. Yeah. Not wrong.
Or watch it's not even pain meds.
Placebo.
Robert M says, so many clavicle fractures. The more memorable, though, was an athlete towards the end of late soccer practice got hit and bit through his lip when he hit the ground and landed on his shoulder. So when he presented, he was just covered in blood. He said his shoulder hurt a little bit from landing on it, but we were more focused on his gaping facial wound that needed stitches. Sent him to the emergency department to get his face looked at, and when they took an x-ray to double check his shoulder, because he was like, yeah, I mean, it kind of hurts. Granted, this was a couple hours later.
Yeah.
Turns out he had a small fracture at the end of his clavicle that with everything else going on, the distracting injury was missed. It was also so small that it hadn't caused any deformity or swelling. So I wasn't suspecting anything more than a bruise at the time.
Yeah.
Yeah, it's so funny how they can like present. I was just thinking about this too, because I feel like even different parts of a bone or like parts of your body, like think of when you like stub your big toe or like your pinky toe, like it hurts so
hurts.
bad. But then sometimes people like fracture something and like not know that it's fractured.
Yeah. Oh yeah, 100%. 100%.
So it's tough.
Oh, absolutely. Absolutely tough.
But I thought this one was funny with just like,
yeah.
He was like, what? He's like, I'm more concerned about all this blood.
Yeah, well, yeah. That sounds great, but take care of the tongue you almost bit off. Or his lip.
His tongue? I think it was
lip.
yeah.
Lip. The lip you almost bit through.
Have you had someone bite through their tongue?
No. Not yet.
I had a friend who bit through his tongue.
That's brutal.
Like it came off, like a piece of his tongue.
That's crazy.
Yeah.
That's brutal.
It bled a lot.
I bet.
I mean, I wasn't there, but I heard.
I didn't see it. Heard it.
I can't remember if they like stitched it back on or if they just put a little stitch. I think they did a stitch,
nice.
But I'm not sure if they like stitched itself back on. I don't remember.
Nice. Cool.
Oh, we do have a humerus fracture one.
All right. The humorous side of the stories.
Yes. Oh, a couple of them actually.
Nice.
8th grade football. Hayley S says it was a major step-off deformity. Thought it was dislocated, and his dad told me to reset it. I told him not, and we transported him to the ER. It was a clean line at the neck of the humerus. Luckily, it didn't need surgery, and he was casted for 6 weeks. Played the last game of the season and went on to wrestle that winter. He's now a freshman and hasn't had any problems.
Nice.
That's actually something you really have to pay attention to before you like start yanking on that.
Yeah. Start cranking on it.
Right. Good on you, Hayley, for
big time
knowing the difference.
Yeah.
There are some times like when a kid's in so much pain that I'm like, I'm making the right decision, right?
Am I missing something?
I'm like second guessing my life.
Yeah.
No. I feel your shoulders in socket.
Yeah.
Yes, your shoulder's in socket.
Yeah. I know it's there.
No, it's your shoulder's in its socket.
Yeah.
One time I went out to soccer for a dislocated shoulder.
Uh-huh.
But by the time I got out there, because we had to like drive a golf cart out there, by the time I got out there, it had either spontaneously reduced. I think it spontaneously reduced. I don't remember if he had done it before. But anyway.
I feel like those people, tends to be a history.
Yeah. I mean, I don't work with men's soccer. I didn't work with men's soccer, but I was just covering that night. And then, but while I was out there, I was about to leave, and then someone dislocated one of their metatarsals.
Whoa, that's crazy.
Yeah. And actually, I thought it was fractured. I mean, I wouldn't have put it back anyway, because what?
Yeah, what?
Yeah. But I just sent it for x-rays. I think I might have, it was also late. I might have sent it to the ER. And then they're like, it's dislocated. And I was like, what? No wonder he was in so much pain.
Yeah. That's wild.
Yeah. He just got kicked, like, because those little soccer cleats are so thin.
Oh, yeah.
Just got kicked right in the first metatarsal and, like, dislocated the metatarsal head from the navicular area. Like, that, like, spot.
I wonder how they reduced it. You just push it back?
Probably some traction and pressure,
just
like, because it dislocated
dorsally,
I think.
Oh, okay. That's interesting. Yeah, I wonder how you put that back.
Yeah.
What's the correct technique to do that?
Good question. It's not in our NATA position statement.
No, honestly, it's not.
It's like funny because you don't think of like other things that can dislocate, but
theoretically any joint could do it.
Right. Well, I know that's what actually trips me out, because my subtalar joint doesn't like to be completely aligned.
Oh yeah.
So I have to like.
What do you do? There we go.
It also really hurts when it happens.
Yeah, well, yeah, I bet.
Yeah. But like I like searched to try to figure out like subtalar instability.
Uh-huh.
I don't know. It's very uncommon.
Yeah, it is.
But you can like see it when it happens. Is like my Achilles is like not straight up and down.
Yeah.
It's really weird. So Maddy also submitted one of her own.
Oh, personal injury story.
Yeah, you want to read this one?
Maddy says, I fractured the head of my humerus while snowboarding when I was 9 and was told by ski patrol I had just dislocated it. But looking back, they never checked if it was actually back in place and definitely should have told me to get an x-ray and see a doctor. I didn't see a doctor for 2 weeks until I admitted to my mom I was still in a lot of pain.
Dude, that's insane.
2 weeks of that. It was a lot of pain. But because none of the adults seemed concerned, I just thought it wasn't a big deal. And I was like, okay, whatever. Guess I won't say anything. So first they were going to cast it. And they spent like 20 minutes trying to size it. Then decided it wouldn't work because they would have to cast my whole torso.
I mean, that makes sense because they'd have to like do kind of above and below there.
Yeah.
That'd be such a pain and probably so itchy.
You're like stuck like.
Right.
Yeah.
Have you seen those ones like the little bar?
Yes, that's probably what it would have been. So they put me in one of those shoulder slings that Velcros your arm to your torso, like the one you get after labrum surgery.
Oh, okay.
And I was just told to wear that for 6 to 8 weeks and handed a set of TheraBands and told to strengthen my arm with absolutely zero instruction or follow-up. Yeah, hey, strengthen.
Yeah. Especially like, how old is she? 9?
Oh, yeah.
9-year-old
Kids know what that means.
Yeah.
And it indeed did not heal correctly. My collarbones are off when you look at me straight on. And I now get costochondritis flare-ups pretty easily.
That really sucks.
Shoulder flexion is pretty limited too. But I think that's decades of scar tissue at this point. It makes me intrigued with how children can learn to perceive pain based on adult reactions. Pain is so interesting. It is very interesting.
Honestly, I feel like that's been a common theme in this episode.
Yeah.
Like it just, so many things can present so differently.
Everyone has a different perception of what they feel.
Also, isn't that crazy?
Yeah, that's crazy. All the adults in the room weren't concerned. So she's like, oh, okay.
I wonder at any point, like, at what point. I wonder this with primary care physicians because primary care obviously has so much on their plate.
Yes.
It's like, at what point do you send to ortho? Do you not send to ortho? But like everyone can benefit from ortho probably, but also are you overriding the system? And like it's a whole.
Also, poor thing didn't get like PT.
Right.
Like just a band said, hey, here, strengthen this bad boy.
Right. Like that's crazy.
See, this is why everybody needs an AT.
Yes. Yeah. Just think of like all the kids who come in and like are like, oh, I never did rehab on this, and you're like, oh
yeah, it's so frustrating.
You never did rehab on your ACL.
Yeah, it's so frustrating.
Yeah.
Ankles, hamstrings. Oh yeah, I never did anything.
You're like, oh, I'm frustrated for you.
Yeah, now I gotta deal with it
because they don't know.
Yeah, they don't know. They don't know better.
Right.
They're not supposed to.
Right.
The system's supposed to.
Right. We got a couple. We got actually just. Oh, here's another dislocated shoulder one.
Oh, all right. And an actual dislocated.
Yes. Sara F said, theater kid dislocated his shoulder inferiorly while rehearsing a sword fight on opening day.
Oh, no.
They did.
On opening day, too. Dang.
Actually, they do that. They do rehearsals. Yeah. It's called fight call.
Uh-huh.
And they only rehearse like the fight scenes. That used to be part of my duty. Like I'd go watch like the fight call and then go watch, and they'd also do like fainting or like falling or like other stuff. They did not have an understudy,
of course
so
not.
He went to the hospital and performed in a sling.
The show must go on.
That's what I said. That's like we just saw Peter Pan Goes Wrong, the play.
Yes.
And that just reminds me.
Yes, they would do that.
Yeah. Actually, I think they had
someone
they
in
a sling.
They had someone in a wheelchair.
And yes.
And a boot.
But it was like part of the play.
Yeah. Yeah. It was a part of the experience.
Because the play goes wrong. They actually had like something go wrong. Paramedics come out. Then the paramedics were part of the play.
Yeah. Yeah, it was pretty good.
Sequel to The Play That Goes Wrong, which is also very good.
Yes.
Not sponsored. I'm just kidding. Actually, no.
No, we're
really
not
sponsored.
Yeah, we're actually not sponsored. but we can be.
Thoracic outlet syndrome.
There we go. What a turn of events.
Aly H said, saw a weird case in undergrad. Kid had unilateral swelling of his left bicep after lifting. He was left-hand dominant, so he said he felt a tad bit weaker than normal, but no other symptoms. Ever. We sent him to the ER, and they life-flighted him to a trauma center because he had a blood clot in his bicep due to thoracic outlet syndrome from an extra rib.
Shout out to our thoracic outlet syndrome episode. We did talk about that. If it's venous, you gotta be worried about blood clots.
You know what? I wouldn't have even put the two together. It makes sense because he had an extra on both sides, but they left the right one. The following year, he started having classic TOS symptoms on the right side, so they went in and removed that rib next.
Dude, just take them out. Just take the ribs out.
Okay, that's what I was wondering. We were both wondering this, and then I was like, is it like a quality of life thing?
Well, I'm sure they don't want to just start, let's just start hacking at this
arbitrary surgery. You don't need it right now.
Yeah, it was probably
we'll deal with it when it becomes a problem.
If it becomes a problem. They probably thought that way, that's not the problem yet, so there's no, why do more surgery when you don't need to?
Yeah, but...
Or maybe insurance wouldn't cover it because that wasn't the side that was bothering him.
Well, now he's down to... Oh, true.
So they probably couldn't, maybe. Again, you can't just start hacking the kid.
That is true. Even though you know it's going to be a problem.
Yeah. Insurance doesn't care.
Okay, I think this is our last story.
Oh, nice.
We have a SC joint dislocation story.
Nice.
From Juan C. He says, a posterior SC joint dislocation.
Ooh.
We referred him to the ER. It was misdiagnosed twice.
That's crazy.
Before having ORIF, open reduction internal fixation.
Yeah.
It was a helmet-only practice. The wide receiver was hit coming across the middle directly on the lateral shoulder.
Oof.
Oh, that's exactly like textbook. Hit on the lateral shoulder.
So
Except
unlucky.
That's crazy because usually that causes an anterior SC joint dislocation.
Well, also,
but I wonder if they got hit and it just shifted it back.
Yeah. Well, also, it's just crazy. It's helmets only. What are we doing?
You know what? I've had a kid go unconscious at a helmets only practice.
See, what are we doing, guys?
Yeah, I don't know.
What are we doing? It's your teammate, bro. Relax. You're not going to the league at helmets only practice.
Right. It was an obvious posterior deformity, but he had no difficulty breathing or anything, so we just sent him with a teammate to the ER. He was released with just a shoulder sprain. The x-ray view was only AP, so they didn't catch it.
What's the saying, babe?
One view is no view.
Boom.
Kid went back into the ER because he developed difficulty breathing the following morning. The same ER doc was still there, so told him to go home and see the primary care physician.
Way. No way.
I hate that. You're no, I'm sending you back because we need someone else. I called our doc to let him know, so he ordered additional imaging. Once he saw it, he sent him to a different doc who had him in surgery the next day along with a vascular surgeon in the room just in case he nipped an artery.
Hey, gotta be ready.
He was out all year, of course. The next spring/summer ball, he got an open PIP dislocation. I irrigated with saline, then put wet gauze and sent to the ER. I think they put him in the OR the same day to avoid infection.
Nice.
Damn.
That's brutal. Poor kid.
Yeah.
Wait, when was the... Oh, spring ball, summer. Oh, God, even worse. Spring ball, summer ball.
I know. Okay, so first of all, he gets this crazy SC joint dislocation that needs surgery during a helmets only practice, and then during
the least dangerous aspect of football.
And then during spring, summer ball, open PIP dislocation.
Basically, the times of the year where like the type of practice and the time of the year where if you're short staff, you don't need to be at that practice, right? Based on your staffing levels, right? You don't need to be at this practice. Emergency.
Yeah.
See, so when we start talking about staffing, everybody needs a staff of 20 ATs.
That's how it is.
Yep.
No one's going to be able to fill that, though.
No.
Do you have any more shoulder stories?
I just have the crazy shoulder dislocation one that I've probably told multiple times on this podcast.
Which one?
My sprinter.
Oh, yeah.
For our 4x1 going to nationals, like I think literally the next day we were leaving for it. Coach decided, hey, we're going to do stadiums. Who knows why? And now when I tell people this story about the kid dislocated his shoulder, everyone assumes like, oh, did he like fall? Did he have a shoulder dislocation before? No, guys. He was just trying to get up. He literally was just grabbed the bar, like the handrail, to pull himself up, slipped out. And no, he did not have a shoulder dislocation before. That was his first one.
Oh, was he just super lax?
The only thing I could think of is he was that fatigued.
Oh, and his muscles
he was fatigued.
Oh.
Luckily for us, that wasn't the arm that he had to reach for the baton for.
Oh gosh, but you still have to run.
Yeah, I just have to get his range of motion to here.
Yeah.
He would have been, I mean, he was fine. He did great. But yeah.
I've had a quarterback with an AC joint sprain on the opposite side who couldn't throw, and I wasn't expecting that to affect his throwing, but I guess the rotation is enough to like...
Yeah, and I guess too, because like when you throw, you're like this.
Oh, true.
So maybe that.
But it was the rotation that was bothering him.
Oh, like the actual turn?
Yeah.
That's interesting.
Right.
I mean, I get it, right? Thoracic, right? You gotta do the DAC.
Yeah. Oh, we had someone who we sent for thoracic outlet syndrome. One of our part-times eval'd it and caught thoracic outlet syndrome, which was awesome because it was kind of someone who just was coming in and never really like eval'd. You know those kids?
Yeah. Yeah. Of course.
And we're like, oh, good catch. We sent him, and the doc was like, oh, it's quadrangular syndrome. I think that's
Whoa.
And we're like, what?
What is that?
It's like basically thoracic outlet syndrome, similar to, but it's like of the quadrangular space or something like that.
That's cool.
Yeah, we had to look it up.
See? We're always learning.
Things you like never hear of.
Yeah, we're always learning. That's why it's called practice.
True.
We're always learning.
True. Actually, we did this. So there's 3 of us full time at my work, and between the 3 of us, we have 50 years of experience. Isn't that a cool stat?
That's actually a really cool stat. That's a really dope stat.
It's pretty cool. I make up by far the least of those, but it's pretty cool.
No, but you see, you have all ends of the spectrum.
Yes.
You have like the newer way of thinking. Hey, this is kind of what we do now. Paired
I can't
with
remember the exact numbers, but I want to say it's like 20. Well, I can't really do mental math. It's somewhere around 20. Yeah. I'm somewhere around 6 or 7.
You're 7,
6, 7. And then whatever the difference is between that.
Nice.
I know we have to like write it somewhere because I think that's pretty cool.
That's a great stat, but that's going to change every year.
No, it's still over 50 years of combined experience.
But you can at least, then when it gets over 60, then you got to change it. Over 60.
But I think we like, I don't know, it's like early 50s right now.
Yeah, that's dope.
So I feel like it's not.
That's a really cool stat.
Right?
That's really cool.
Anyway, I think that's all.
That's the shoulder.
We're getting ready for transition out of football season now.
Yes, basketball. You are. Yeah, that's where I'm transitioning from volleyball to basketball.
Yes.
I get to hear, get him up, coach. Let's go. First horn.
You love that.
I do. It's the best thing to repeat. It happens every time.
So we have a lot more interview stories for you guys coming your way. We also have CEU episodes in the works and more BOC IRL episodes. Make sure you head over to our Instagram if you don't know what any of those are, or if you'd like to get some CEUs, we have a tutorial on how to get those CEUs. Or you just find an episode that says CEU episode, and it's all through our partner, Clinically Pressed and Athletic Training Chat. So you just select a course, enroll in it. Some are free. Some are really affordable, and they really also help support the show. If you are also interested in other CEUs, we have a MedBridge subscription, which I just recently did a shoulder CEU with them, which was actually really helpful and really cool with some of the special tests that I've now added into my practice.
For sure. Great content.
Yeah.
Great content.
I know some people have had problems with the fact that like some things say athletic training like advanced while everyone else is intermediate or something.
Mm-hmm.
But I think what I was reading, and I don't know how, like, don't exact quote me on this, but basically what I was reading is our system is a little bit different. So like our wording is different than theirs. So it's not that we're lesser than them.
Yeah.
So I think just I've been hearing that backlash a little bit.
Yeah.
But I think it's actually like our advanced like is one of our minimum.
Yeah, because it goes I'm pretty sure if I remember. It's essential, advanced, and mastery.
Yes.
I believe.
Yeah.
I believe.
Something around there.
Yeah.
But anyway, you can scroll the show notes, get $101 off using code ATCorner for MedBridge if you're looking for a subscription for CUs. And we're also rolling out CU bundles. So if you're looking for like bundles of CUs, we have like all of season 1 or all of season 2, or we're gonna have like different bundles. So keep an eye out for that, or look on our partner's website, also down in the show notes. And I think that's all we're gonna share.
Thank you for helping us showcase athlete training behind the tape. Bye.